COVID-19 is real.
Assalamu alaikum, my name is Zamzam and I'm a paediatric intensive care nurse and one of the many Somali healthcare professionals working on the front lines during this pandemic. This message comes to you with great importance. We are wishing to advocate and inform our community of the risk that COVID poses to us.
As you are aware, we are in the midst of the second wave of coronavirus here in Australia. However, this time we are seeing larger numbers of infections and hospitalisations. The state of Victoria has been particularly hard hit with the highest number of deaths and infections Australia-wide.
This has particularly been evidenced within the Somali community. We're yet to receive data on the numbers of Somalis who are being infected, hospitalized, or have even died from COVID-19. However, informal data has shown us that COVID-19 continues and still is quickly spreading within the Somali community.
Evidence from the US, the UK and Europe has also shown us that Black people and people from migrant communities are disproportionately impacted by COVID-19. In the UK, a third of people admitted into the ICU with COVID-19 are Black people and people from non-white ethnic backgrounds. In the US, Black people are twice as likely to get COVID-19.
There are demographic and socioeconomic reasons for this. We know that many frontline and essential workers come from migrant and Black communities. We know that people from refugee backgrounds are much less protected from this virus, and economic disparity is one of the leading causes of this.
People from marginalised communities have much higher rates of chronic health conditions, and a large part of this does stem from racism and discrimination. These chronic health conditions not only increase the risk of contracting COVID-19, but also increase risk of becoming seriously ill from it at a much higher rate than the general population.
We understand the barriers such as language and the lack of culturally appropriate healthcare can lead to a mistrust of the healthcare system, and this can further intensify health disparities. When we are facing a global pandemic such as this one, these issues can have a devastating impact.
There's material circulating within our communities regarding whether or not COVID-19 is real. These are conspiracy theories that are creating fear and harming our community. COVID-19 is real. Many of us have seen it directly affect patients, myself included, or have family members affected, and it takes more lives of Black people than other groups. Many of the conspiracy theories are pushed by people who aren't medically trained, who don't understand how viruses work or spread, and who don't share our lived experiences. They have the privilege of speaking about a virus which doesn't impact them in the same way it does us. It's crucial that we make sure our information comes from sources that are reliable and not fall for scams or misleading information.
Our community is vulnerable and we have to do what we can to protect our loved ones. We must all be proactive and help the spread of this disease. Please take care of yourselves. Please self-isolate, wash your hands, wear a mask and promote overall good health. We understand that the anxiety is super high and many people miss their family and their friends. But please guys, please do not visit your family, your friends or even your neighbours. This is particularly important for people who have already shown symptoms, who have been tested and have already received a positive result.
We understand this is a stressful time for all. We understand our culture is one that promotes close family relationships and that being away from our loved ones is difficult. But this is the best thing we can do for each other during this time.